Good morning, and thank you once again. It is indeed a great pleasure and a privilege to be amongst you. And let me begin by congratulating UAE and the Dubai government, not only for the outstanding expo and for coordinating this session, but for thought leadership and vision across the decades to build and evolve your country into the tremendous role model that it is today. And it is a role model not just in infrastructure, capability, and quality of life for people who come in, but it is a thought leader. And when I heard earlier today the very profound words that health and happiness are among the foremost factors for human development, you reiterated once again how the thought process is really driving development. So I'm especially happy to be amongst you today to share some thoughts on health equity. And health equity is indeed a complex subject and requires a multisectoral approach. And hence, having business chambers come together with governments and experts to say, let's talk about something so important. The pandemic brought to the fore, like never before, the fact that we are one world. We are a global village. We are connected. We are interconnected in a multitude of ways. And therefore, none of us are safe until the whole world is safe. Not just in the aspect of vaccine, but across the entire spectrum of healthcare. And before we really jump into things that we can do, I think it's important to highlight the vast differences that exist. In low-income countries, the average life expectancy is an average of 62 years, while in high-income countries, it is 81 years, a 20-year difference, almost a whole generation. So a child born in Sierra Leone can expect to live for 50 years, and someone born in Japan can expect to live to 84. This itself starkly highlights the difference in healthcare and the outcomes of an unequal healthcare system. Children less than 5 years of age are 15 times more likely to die in sub-Saharan Africa than in the rest of the world due to pneumonia, malaria, diarrhea, and other diseases, all for which we have a cure. In developing countries, they account for 99% of the annual maternal deaths. So a woman in Chad has a lifetime risk of maternal death. Her risk is 1 in 16, whereas a woman in Sweden, her risk is 1 in 10,000. So I can keep on giving you statistics like this, but I just suffice to say that this is a significant problem, and I once again commend you for focusing on this. And coming to the more recent environment, vaccine inequity. Africa, being 18% of the world's population, has received less than 4% of the world's vaccination. And so, can we ever see the end of this virus till we know that the whole world is vaccinated? And this indeed really highlights the ongoing problem. Apart from ongoing challenges like unemployment, like poverty, like inequitable disease burden, health is one of the biggest factors. I just wanted to make these opening remarks, and then later we can discuss how. But I believe that the pillars which enable a global health equity include partnerships across the board, whether it's in building hospitals, managing hospitals, sharing science and research, using technology, innovating, tech adoption and enablement, and finally and most significantly, manpower and human resource with capacity building. I think it is estimated that the global shortage of healthcare workforce is going to be almost 18 million. So the ability to seriously plan and partner for this. But most importantly, I think it needs a vision and policy enablement across the globe. So
Thank you, Dr.
Congratulations for this.
Thank you, Dr. Sangeeta.